Hi everyone, my name is J.R. Smith. I'm a medical student at the Mayo Clinic and the creator of the Evolving Medic YouTube channel. And welcome to this installment of MEDizzy Inspire, where we speak with some of the most prominent healthcare providers across the world who share their story and what drove them into medicine with the hope to inspire the next generation of healthcare professionals. In this episode, we interviewed Dr. Ian Quigley, who discusses how an interest in chemistry and, surprisingly enough, detention from making fireworks is what eventually led him to pursue a career in medicine. So, without further ado, let's listen to his incredible story.
Okay, so it's a bit of a complicated story. When I was at school, I wanted to be a pharmacist. I went to a school a little bit like Hogwarts. So if you've read Harry Potter or seen it, you'll know what Hogwarts is like. So my school was a little bit similar, without quite so much magic. I wanted to be a pharmacist, and I was at the age of about 16 or 17. I was meant to be spending some time in a pharmacy shop, getting some work experience. But my teacher in my boarding house caught me mixing up some chemicals. I was trying to make some homemade fireworks. And you can imagine that if you're caught at school trying to mix explosives, then the school doesn't like it very much. So my school cancelled my attachment with the pharmacy shop and made me work in a garden doing some gardening. And while I was gardening, I was working with a young medical student. And this man was telling me what to do, but he was also, while we were pulling up weeds, he was telling me about medicine. And it became apparent that working with people, with patients, was a far better thing than just being a pharmacist for me. I mean, clearly pharmacy is important to many other people, but for me it made more sense to combine my love of science with helping people solve their problems by being a doctor. So by doing some rather naughty things at school, I got myself into a position where I met a medical student, a bit like you, I was many years ago, and that got me interested and involved. I'm a general practitioner. I've been a GP for 26 years now, so I'm quite a senior GP. My job involves several different things. So I see patients and I try to help them. I teach undergraduates like you, but I also do some other things which I find important but less interesting and less fun. And those things are management, trying to manage my own practice. So I work with 6 partners to look after 17,000 patients. So we have quite a lot of management stuff to do, including looking after our staff. I work with other practices in my local area to try to improve the work that we do, which is all important, but to me it's less interesting and less fun than solving patients' problems with them and teaching students. So how do I keep myself interested? Well, I keep a balance of what I'm doing. So some things are definitely fun, some things I just have to do because that's part of the job. And by keeping that balance, I think I can keep myself going. And the other thing that I do periodically is go off and work abroad. So I've worked in Nepal and Namibia doing voluntary work. So working in Nepal initially with the Himalayan Rescue Association, looking after ill trekkers and local people high up in the mountains. And then a little bit later on, a few years after that, doing some work, mentoring some rural healthcare workers. And that kind of thing really combines seeing patients face to face in an extreme environment and doing some teaching, which are really my main passions. So yes, by keeping a mixture of things going and by doing some work abroad, I keep my enthusiasm going. Okay, so if we're talking about professionally, then I think any time that I can see a patient and the consultation goes well, in particular when I can see someone and understand really what is wrong with them and try to help them. So sometimes that can be just very small things. Sometimes it can be understanding why they're anxious about something. Sometimes it can be a more dramatic thing. So, for example, a patient came in 4 or 5 years ago to the practice wanting a medical certificate for work, and while he was in the practice, for no obvious reason, he had a collapse and a cardiac arrest, and we were able to resuscitate him. So we did CPR, and then we defibrillated him, and within a few seconds he was back alive. So that was, a wonderful thing to do, but we don't do it very often. On a more mundane basis, maybe sometimes I see patients, and just by examining them I can know what's wrong with them. So, for example, a couple of months ago, a lady came to see me, and she was very stiff, and she had a tremor like that with her hands. So that tremor was typical of Parkinson's disease. So by listening to her history and by examining her, I was able to identify that she had Parkinson's disease without doing any blood tests or any MRI scans or anything. But just by taking a history and by examining her, I was able to understand what her problem was and start her on the right medication. And then within a few weeks, she was feeling much better. So that kind of thing to me is very rewarding. And then on a personal basis, really anything that involves time spent with my wife and my boys. So I have 2 boys, one aged 26 and the other one is going to be 30 very shortly, so they're not young exactly. And my dog. So any time spent with my wife, my dog, or my boys, not necessarily in that order, is worthwhile. Yeah. Okay, well, I have a variety of ways. If it's something at work, then I will often have to talk it through with my wife. She is a nurse, so she has a good understanding of the kind of things that make life stressful for a doctor. Sometimes talking through with my partners. So as a GP in England, most GPs work with doctor partners, and I have 6 partners. So we get on well together, and sometimes if there's something very stressful at work, then just by talking to them, it can be helpful. And then when I come home, then I have things like this. So I know in Queenborough they do a lot of this with
yes.
a slightly different instrument. But so I'm not going to play it for you because I'm not that good. But so playing guitar or doing exercise. So I run quite a lot and I work out in the gym. So those are the kind of things that keep me sane, if you like. So this goes back, started 10 years ago. And the very first thing that happened was that I was talking to my wife. I was feeling a bit stressed, as I said a moment ago, because we had just sent our younger son, James, off on a trip with the Army cadets to go skiing. And I was saying to my wife, look, he has all the fun. You know, I'm 45 or 46 and I'm not having fun, and he's having all the fun. And she used Google and she found a course that I could go on studying medicine in the mountains. So I went on a course run by Wilderness and Expedition Medicine, and this was a trek to Everest Base Camp. And while doing the trek, we had some teaching. As part of that trek, we went through a village called Ferriche, where the Himalayan Rescue Association has a clinic, and we visited the clinic. And it was very obvious that it was the kind of thing that someone like me could do. So I applied to go and work there. And I think 2 or 3 years later, I was given the job for 3 months. So my wife and I flew to Kathmandu. We had a week's training in Kathmandu, including some language training and some training about some of the illnesses that we might encounter. And then we trekked from a little town called Besi Shahar. We trekked for a week up to Manang at the height of 3,500 meters altitude. And then we worked there for 10 weeks and then we came back. What are the challenges? Well, there were lots of challenges. It was very cold at times, quite warm at times, but quite cold at times. My wife was a bit ill on the trek up to Manang, so she didn't like it very much. So we had a bit of an interpersonal disagreement, if you like, about what it was like to be there. But we worked on from that, and she accepted that it was a good thing to be doing. The patients had interesting problems, so there weren't many of them. There were only maybe 7 or 8 each day. But the patients that we had were a mixture of local people and trekkers who maybe came from Israel, England, Germany, France, Switzerland, that kind of place. America maybe. So these trekkers had conditions a bit like maybe headache, flu, gastroenteritis, maybe severe diarrhea. But some of them had altitude problems, so high altitude cerebral edema and high altitude pulmonary edema. And a couple of them needed evacuation with a helicopter. So sometimes it was quite tricky to arrange the evacuation because it required us to contact the insurance company, because a helicopter evacuation costs maybe £5,000 or £6,000. So someone's got to pay for it before you evacuate the patient. So that took a little bit of negotiating, sometimes tricky telephone discussions with the insurance company before we could get the patient out of there. But yeah, it was interesting and it was fun. I think in times of COVID, there has been a move, certainly in England, to switch to using the telephone for patients, or for using Zoom like this. But patients need to be seen face to face, and they need to be touched. So really, sometimes the only way to really understand a patient and to allow them to know that you've understood them is to see them face to face, let them look into your eyes, and you look into their eyes, and to examine them. And patients often need to be examined, and they value being touched by doctors. So I'll give you an example, if I may. I was working in a COVID clinic in April 2020, just while we were in the first wave of COVID. And I saw a lady who had some relatively minor physical symptoms, but she had lost her husband about 3 weeks before that. So this was at a time when people were all staying at home, they weren't going out meeting each other, people couldn't meet their families, and she had her husband die. So she came to see me in this clinic, and I was wearing face mask and gown and gloves. But she talked to me about her symptoms and about her husband and her husband's death. And she was crying a bit. So I reached out and I just held her hand. And she cried a bit more, and then she kind of smiled at me and said, Dr. Quigley, you're the first person who's touched me since my husband. And that touch was something really important to her. So it made a big difference to how she felt. So to summarize, really, one of the important things about doctors is that we're given the privilege to talk to people, but also to touch them, to use our hands in ways that other people don't. And I think that's something that we need to remember.
Thank you for tuning into this episode of MEDizzy Inspire. If you enjoyed the video, make sure to like and subscribe, and stay tuned for future videos where we'll continue to speak with some of the most inspirational people across the field of medicine. See you guys next time.